What I'm going to talk about today is community health needs assessment, but then also to be visiting about how we've been able to apply the community health needs assessment result and the subsequent planning to our own organizations here in North Dakota, and talk about the processes we've used to some degree, and then also to be able to talk about the benefits that we've realized from that collaboration. So we'll start talking about community health needs assessment. What is a community health needs assessment? Obviously, different healthcare providers need to identify the healthcare needs of the communities that they are serving. And this tool is a great way for those healthcare entities to determine, here is what our service area is, here's what those needs are in our particular area, and then it allows planning to take place for how we can facilitate providing for the healthcare needs in those specific areas. And it also is very important that through this process, we get a broad range of community input, community support in order to truly find out what those needs are. Again, why is it done? It helps to identify what the needs are, but then also it helps facilities to be able to identify the resources that are needed to meet those needs that are identified in that assessment process. A variety of organizations do community health needs assessment, and I've included a few of those entities and organizations that perform community health needs assessment. A critical access hospital, for example, needs to conduct a community health needs assessment because it was mandated by the ACA, but again, it's also a very important tool to identify those needs and move forward. Public health entities, in order for them to be accredited, they need to have a needs assessment, but more importantly, put together a community health improvement plan so that that public health unit then can address what the needs are within the communities that they serve. A community health center is also required to identify to HRSA, whether it's with a grant application or subsequent reporting from the grant application, they need to report exactly what those needs are, and then health centers need to identify how they're meeting those needs in the scope of services that the health center has provided. Often, organizations independently conduct these community health needs assessment, whether it's, again, the hospital in a small rural community or public health unit or the health center. Sometimes they're done independently of one another and don't necessarily link together as far as identifying those needs and working together collaboratively. Those organizations and communities, I think, that are the most successful are those that have found a way to work together, conduct those assessments together, and then subsequently do planning moving forward as well. I want to talk a little bit about the community health needs assessment process. And this is a great slide that of information that I found on the healthycommunities.org website. And I think it really encapsulates very well what that process is. So at the top of the screen, you'll see that one of the important things to do is to just take a step back to say, what do we want to accomplish? And what's the goal that we have as we work on a needs assessment? And then also we need to identify who are our stakeholders, and we need to engage them in order to find out the information that we need. Again, whether those stakeholders are local healthcare providers, whether it's local clergy, government agencies, a variety of folks should be included in providing that input and into participating in this whole process. And then identify your community. What is the service area of your particular organization or organizations that are working on this assessment? What is that community that we're going to define as we look at gathering information? And then we collect that data. It's done individually through surveys. It's done individually through interviews. It can be through focus groups. There's certainly additional information that's available online in order to identify what those needs are from county health rankings and from a variety of sources. That information is then gathered. Folks then come together, first of all, in smaller groups, and then come together in large groups to really be able to look at the information that's been collected and then to identify those needs and then sit down and prioritize what the needs are that have been identified. And of course, once those needs are identified, then we need to document those results. What is that entire scope of what that assessment consists of? And usually it's put together with a great deal of information that's very useful to all the healthcare providers that participated. And the important thing is not to let that be a binder that sits behind you on your credenza. The important thing is to use that information, use it as a Bible as you're moving forward with doing any planning for healthcare needs in the future. And then we want to talk about implementation strategies. We've identified what those needs are. Now let's develop a plan to implement the strategies that we want to engage as we look at the community health needs assessment information and develop those plans. Then it needs to be an ongoing process of monitoring. What results have we achieved? What's the progress towards what those goals are identified? And then if the priorities change somewhere throughout the course of the implementation, it's important that those plans get tweaked and adjusted according to what the current healthcare needs are. So how do we use those community health needs assessment findings? Certainly our organization, but many organizations take that information and they develop the individual organization strategic plans. I think the most effective communities are those that healthcare providers come together. They collectively figure out a strategic plan about what the needs are in the areas, and they're accountable to each other then to make sure to facilitate whatever initiatives were developed through that strategic planning process. But then how do we implement that? And then how do we monitor that in the future? The implementation of the strategic plan that has come together is a very important piece of making sure that it's successful. And then working together with the public health units locally in their community health improvement plan and incorporating that into all of the entities working together. In our particular area, we call the subsequent monitoring and ongoing dialogue, we have a population health committee. And so they really meet monthly. They talk about the progress, they adjust the plan according to what needs are coming up, and et cetera. And I really believe that those that realize the greatest community benefit through this process are those that do those assessments together. And then, as is in the case in the state of North Dakota, the Center for Rural Health in North Dakota aggregates that data from individual providers, and you can go onto their website and see statewide what the needs are, how your area compares with other communities, or how that compares to the state average about what those needs are that have been identified. So what I want to talk about now a little bit is our collaborative community health needs assessment and planning. Our organizations, I happen to be privileged to be the CEO of Sakakawea Medical Center, which is a critical access hospital located in North Dakota. And then I'm also the CEO of Coal Country Community Health Center, which was established as a health center back in 2003. And we provide a variety of primary care services in our area. Just to give you a frame of reference of where we're located in west central North Dakota, about 70 miles northwest of Bismarck. Our service area is about 4,000 square miles, and we have a service area population of about 15,000 individuals. The major industry in our area is coal and power plants, so you're welcome for us providing power so that we can all operate our computers today. But you also see a map here that includes where we're located, but then also the critical access hospitals, the FQHCs and RHCs in the state of North Dakota, and how those referral frameworks work. That gives you an idea of where we're at. So we started our community health, collaborative community health needs assessment planning back in 2011, when I was fortunate enough to have the opportunity to be the CEO over both organizations. It's a model that's not necessarily very prevalent across the country, but it certainly works for our area. We also have integrated governance, which we think makes us more successful here as well, so that the health center and the hospital are always aligned in the vision and in the strategic initiatives that we embrace. But then we also have a public health CEO that represents that particular service on our board as well. So in our initial needs assessment, we included the hospital, we included the health center, we included public health, but we also reached out to other separate entities in our area as well. And those entities then included the nursing home and EMS. We also obviously had other entities participate, state and local government, et cetera. But that's how we initiated our particular planning. Sorry, my slide got stuck. All right, what were the benefits of our collaboration? You know, again, we did individual planning, we did collective planning, we did collective implementation, and we really worked together well in identifying those needs and then moving forward with the planning process, implementing that planning process. And again, that population health committee really does an important part each and every month, meeting, monitoring that progress, and then again, tweaking what we're doing for an implementation plan to address different needs that may be surfacing over time. And I can't emphasize enough the importance of the collaborative process in doing so. And we really feel that we've developed a patient-centered medical neighborhood of care, which between our organizations has improved financial performance, certainly improved clinical outcomes and those quality metrics, and it improves how we deliver care as a group of entities through care coordination and transitions of care. We have care coordinators at each of those organizations that come together. And the reason we're able to do that is because we're doing collective identifying of needs, collective planning, and it just makes for a more solid relationship when you start working on the different initiatives that you might have. The other thing that we've been able to accomplish because we work together, we've implemented a new EMR together. We're participating in value-based care, whether that's Medicare ACO, commercial models, or in Medicaid managed care as well. This has also allowed a framework for Patient Family Advisory Council, which is a council that's made up of folks from each entity across our service area, but also we bring patients in that may have utilized hospital services, clinic services, EMS, long-term care, and we visit with those patients as a collective group. All of these things, again, wouldn't be possible if we weren't working together from the start with our assessment. But one of the things that really comes out as well, we've all been faced with increased challenges during this time of the COVID-19 pandemic. That framework of collaborative planning, collaborative work together certainly has lent itself well to us being able to address the local needs that we have and the responsiveness during this whole COVID-19 pandemic. And of course, we really feel confident that the collaboration that we've had in this whole process of identifying, planning, implementing, and et cetera, will serve us well for any future needs that we may end up having as well. Because as healthcare providers, the things we are adapt to and very good at is changing how we do things and what we're doing to identify or to work with our particular communities. So I want to thank you very kindly for allowing me to share this information, and I look forward to hearing the other presenters as well.